Broadcasting live from the Business RadioX studio, it's time for Family Business Radio. Showcasing outstanding family businesses and the advisors who assist them.
Good afternoon. You're listening to an episode of Family Business Radio. I am your host, Anthony Chen. We have an amazing guest with us. Joining us today, we have Dr. Jamie Austin with Austin Dental of Roswell. Welcome to the show.
Thanks so much. It's great to be here.
Great. Thank you. So share with our audience as to your story of what got you into dentistry and what got you into starting and buying out your own practice.
Awesome. Yeah, it's a long story, but so basically I was in college and I was working the summers at a craft store, and I was really interested in picking up a second job to earn some income to make ends meet through college. So I had a colleague who was currently working at a dental office. And so she said, why don't you come on over, and we're hiring. So I went over there and I was hired, and I was working in the chart room at a pediatric dental office. From there, they taught me sterilization and brought me into the operatory rooms where they did treatment on the patients. So I was really curious. And so I got to the point where, being really curious about what the doctor was doing and how he knew what to do and read the x-rays, so on and so forth. So that's what piqued my interest in dentistry. The next semester, I took a biology class and just loved it. And my professor really encouraged me to pursue biology. And so I put the pieces together, and that's how I got introduced to dentistry.
Mm-hmm. Now, before you got introduced into dentistry, what was your initial major?
I actually was undecided. So I went to college undecided. I went to Georgia College and State University. So they had a great program for those of us who were a little unsure of what we wanted to do. Mm-hmm. But through all those experiences, I was able to put the pieces together.
So as you're going through the path of going into biology and then eventually getting into dental school and then working into dentistry, can you remember perhaps a case or a patient experience that made you go, yeah, I'm definitely in the right career?
Yes, absolutely. When I was a dental assistant before dental school, I was working chairside with my doctor, and I had the opportunity to make the temporary crown. We're doing a crown preparation for a patient, and the doctor taught me how to make the temporary crown, which is what they wear while the final crown is being fabricated. And so when I got to actually put my hands on that and make the crown myself, I was sold. I was like, this is it. I could make the crown, try it in, do all the work. The patient was happy. It was awesome. I loved it. So yeah.
All right.
Yeah.
So then what other parts of dentistry that as you're working through today that makes you wake up and go, yeah, this is definitely why?
Yeah. So my patients, I do it for my patients. I love my patients. They're like family. So we're a small private practice, and I know every patient. They know me. We talk about our families. It's just, I do it for them. I love and seeing the same people over and over again and learning about their families and helping them. And you learn their mouth, their likes, their dislikes, and you can just really make a difference in their life. And I love that. I love that.
So then peeling back the onion here, for a lot of people, when you mentioned starting out your work at pediatric dentistry,
yes.
I can't imagine kids being thrilled going to that. How was that experience? And did that really continue the influence of maybe even stepping foot into pediatric dentistry?
Sure. Good question. At that moment, I was just learning dentistry, and all I knew at that time was pediatrics and children. Mm-hmm. And that's definitely a different type of dentistry. So it was a good experience and I enjoyed it. But when I actually worked as a dental assistant with adults, I knew that was my path because I really enjoyed the type of procedures we can do with adults versus children. I love seeing children. We see children in my practice all the time. It's a lot of fun, and we can really teach them to be excited about dentistry and try to make it a positive experience for them. So I knew that I wanted to work with adults and be a family dentist, a family and cosmetic dentist, so I can see everybody in the family and not just specialize in children. So yeah.
So then for those of us that are not in a know or at least familiar with the whole dentistry industry or just practice of dentistry, can you share with us what does it that helps differentiate your private practice than every other dentistry, or I guess we'd call it the more larger corporate ownerships of larger practices?
Yeah. So at my practice, like I mentioned before, we really get to know our patients, and we have control to take care of our patients the way they should and deserve to be treated. For instance, we're there to, when you walk in, we know you by name. Front desk, Miss Radana will greet you and will greet you by name. We have the time and the resources to treat you the way you deserve to be treated, and bring you in and allot the appropriate amount of time to spend with you. And so it's not rushed, so that we can really do a thorough job and exam and cleaning, so it's done to the highest standards possible. Mm-hmm. You'll also, with all my team members, like I said, it's about relationships, and we can really spend the time with you. We're a private practice, and we aren't controlled by insurance. We aren't controlled by any big bosses that will tell us or explain or have expectations. We can really just treat you the way you deserve to be treated, and provide the services that are honest, and with knowing it's coming from a good place. And integrity is one of our core values, so we'll definitely take care of you.
And for those who don't have the experience running a practice or working in dentistry, because you mentioned some of the phrase of being owned by an insurance company or a big box store. For those who are just not in the know, like, what is the differences in terms of running that and then coming to a private practice like yourself?
So there are larger practices that are could be owned by larger companies that kind of manage it. But versus my practice, it's owned by myself, the dentist. We can make those decisions and call the shots, and not have, like I mentioned before, avoid having a business calling the shots, whereas I can be there to, take care of you the way you deserve to be treated without having the big boss, kind of controlling things, if that makes sense.
So this is more of a relationship between the actual dentist and the patient, as opposed to, it sounds like the alternative is having manager or boss per se, as a third party relationship between the dentist and the
kind of, you have a boss over in Alabama, but the practice is in Georgia. So it's like that, where it can be managed on premises, and all about the patients and taking care of them the way that I myself, Jamie Austin, want to take care of our patients.
Kind of show us a story of, as you're going through this dentistry journey. Now, if I remember correctly, you now have this practice 4 years in.
Yes. I worked as an associate after dental school, and that was a great experience. I had some great mentors, but in 2020, we just decided to start a family, and we were moving back to the Atlanta area. My husband had a job opportunity, and so it was the time to start looking for the next step. Mm-hmm. And so I came across this practice, and that was for sale, and met the doctor, and we really had a lot in common. He is a great dentist, great person. So it was somebody I wanted to take over his practice, because I knew we practiced the same way, and he was really close with his patients. So it was definitely a good fit. So it was time to make that next step, to practice ownership and go the next route. So we did.
So it sounds like there's 3 major life events going on in that already crazy year of 2020, which I guess we shall not name. So let me get this straight. So you moved, decided to start a family, and buy a practice.
We did it all at the same time. Mm-hmm. Yep. My daughter, when I bought the practice, my daughter was 5 months old when I took over officially. So through my maternity leave and everything, I was managing, getting everything ready for the practice, raising the newborn, but it worked out really well. So it's been a very great decision. We love it. Yeah.
So for those that are listening to, wow, it's like a lot of things all happening at the same time. Probably one of the most stressful year in, I'll say, in decades that people would ever experience. Like, how did you, walk us through, how did you navigate that?
Day by day, one foot in front of the other. Being a practice owner, a business owner, there are things that come your way that are unexpected, and you work through them day by day, one foot in front of the other. There's also resources with other practice owners. There's a group of us that are private practice owners that we collaborate, work together. So there's a nice, strong dental community, which is great. So I definitely rely on that. But to navigate it back then, you just one day at a time, and you learn as you go, and everything. I feel that as you treat everybody the way they need to be treated, including your employees, your team, your patients, everything works out.
So with those three major changes or challenges coming into you, which of those are, I would say, the most challenging, or are they all different in a way?
I would say being a new mom was probably the most challenging, navigating being a new mom and being a working mom at first. But you learn how to manage it and you move on and you go. Yeah.
So then for those that are listening that are probably working moms themselves or on the fence in terms of making that decision, if I start a family, would I even have the time? Would I even have the bandwidth to really balance both? What advice would you give to them?
I would say, if you have a will, there is a way. So if it's what your heart desires, you will find a way. And it's all about managing and juggling. You have to have a great support system, and including your spouse or family or a good daycare or school. But it's definitely manageable. But if that's what you want to do, there's definitely a way to do it. So I'd say don't be afraid, because no matter where you are in life, there are always challenges, but you can always find a way through.
Mm-hmm. And so now that we are 4 years after purchasing the practice and starting a family, what was, I guess, the most memorable part in those 4 years experience?
That's a great question. Most memorable. Let's see. 4 years in, I now have a second child. So that was another memorable event. So navigating that with two little ones.
Well,
so
congratulations.
That's
how old is
huge.
So we know the first one's got to be at least 4 years old.
Yeah.
At the time. Now, so how old is the second one?
About 2.5.
Okay.
Almost 3. It was great having 2. And now it's to the point where my children they love coming to the practice. They say, we want to come to mommy's practice. Can we come work with you today? I think that's really exciting, but very memorable. We've added and we've grown. We've added on new procedures such as Invisalign, Botox, core whitening, implant placement. I've added some technology such as the iTero scanner, which is a way to scan the mouth instead of taking impressions. Also, I'm proud that we have the cone beam. So it's a CBCT, so it takes 3D images. So it's great having that equipment here in the office so that we can diagnose properly and we can actually place implants and do procedures like that in our practice, right in our office.
Mm-hmm. So for those that are not in dentistry, the CBT and the cone, what does that mean for us non-dentists?
Yeah, it basically means we can take a 3D image of a tooth, of the jaw, to show us if there's pathology or disease, or to measure the amount of bone to make sure it's adequate for an implant. So yeah, just basically 3D. Normally you go to the dentist, you have x-rays, you take the typical x-rays once a year. Those are 2D images. But the CBCT or the cone beam takes 3D images. So that's the major difference there.
Oh, okay. Good to know. And then you mentioned the other services, and I think did you mention Botox? Did I hear that right?
Yes.
How did that get into dentistry?
Yes. So that came about maybe 9-10 years ago or so. Where dentists are now doing more Botox, and a lot of it can be for wrinkles of the face, forehead, eyes, so on and so forth. But it's also really great for people who grind and clench their teeth. Oh. There's a really large muscle that runs along the side of your face called the masseter. It's a huge muscle. And so if a grinder or clencher, if they take out their daily stress on their teeth, that muscle can enlarge in size and become very strong. And so we can actually inject Botox to help relax those muscles and calm down. So to minimize clenching, grinding, and minimize that pain and wear and tear on their teeth. Yeah.
Okay. I never would have in a million years guessed Botox to be used in that manner. So what other forms, jumping right down the rabbit hole, is when people think of dentistry, they just think of, cavities and teeth cleaning. What other myths that you would like to us and say, no, there's actually more to dentistry, like what the story you just shared with the grinding of the teeth? I never would have guessed Botox as a potential treatment for that. Yes,
you're right. A lot of people think the dentist focuses on teeth cleaning, fillings, things like that. But there's a lot more that we do. The dentist is the doctor of the head and neck. And so the mouth is really a doorway to the rest of your body. So if there's a lot of bacteria in your mouth that's not being cleaned properly, that's replicating, everything like that, that bacteria can get into your bloodstream. And if you have heart issues, it can affect that. It can affect so many things in your body. So it's really important to see the dentist just to take care of your mouth and control the bacteria so that doesn't affect the rest of your body and cause other diseases. So really, we're educators. My hygienist, she's fantastic. We really try to educate our patients to understand the why the services are important. And it is important to go see the dentist at least twice a year. Some patients need to come and be seen, have their teeth cleaned 3 or 4 times a year based on the type of disease and bacteria they have in their mouth. But really, it's about controlling and keeping you healthy, starting with that. But also we do core whitening. We do other whitening services, crowns and veneers. People think of that when they go to the dentist. Invisalign, that's clear aligners. Those are clear aligners. Everyone knows what Invisalign is, which is great, but it's a clear aligner system to align your teeth, which is really about correcting the way your teeth come together and your bite and all that. A lot of people think that Invisalign is just for looks and aesthetics, but really it comes down to more of function and health. Because if somebody collects a lot of bacteria and tartar and plaque between their teeth, because their teeth are overlapped, that's a spot that could turn into a cavity if it's not cleaned properly. Therefore, Invisalign can definitely realign that and make it easier to clean your teeth at home and keep things healthy. So there's a lot more that goes into it.
So it's a little bit more than just aesthetics.
Yes, absolutely.
So as you're going through this for your journey, what is something that was unexpected for you that you would have liked to have given a heads up as you were running your own practice?
Absolutely. I think insurance was unexpected, learning the ins and outs of dental insurance, how realizing that dental insurance is more of a coupon book these days versus when you think of medical, you think of dental, your medical insurance will cover this, cover that. Dentistry is a little bit different where it's more of a coupon book that will cover a portion of things these days. So that was really new to open my eyes to owning a business, is how to navigate the insurance world.
Okay. So for those who are kind of listening for the first time, then how can they best experience at least a one-on-one or an actual private practice, dental practice like yours? How can they best find you?
Yes, absolutely. The best way to find us is we're off Upper Hembry Road. So they can find us. The best way is to call us at 770-475-3600. Also, they can reach us on our website at www.austindentalroswell.com. And we actually have a spot where you can request an appointment, make an appointment online. You can email us and we can call you back as well. So that's the best way to call the office.
Great. Thank you. And then just wrapping up the show here, we generally like to have some kind of bring back question for our guests. So the question for you is, this being Thanksgiving week, we'd like to close off with the theme of, as you were going through your practice dentistry and learning, what is the advice that you were most thankful for from your mentor? And would that be the same advice that you want to pass on to our listener, or if you have another advice of your own. So give your time to think over. So for all our frequent listeners, this, of course, is the obligatory compliance part of the section. You can fast forward if you want. But the show is sponsored and brought to yours truly by myself, Anthony Chen, with Lighthouse Financial Network. Securities and advisory services are offered through Osaic, member of FINRA SIPC. Osaic is separately owned, and other entities and or marketing names, products, or services referenced here are independent of Osaic. Our main office address is at 575 Broad Hollow Road in Melville, New York, 11747. You can best reach me via email, which is just my full name, Anthony Chen, CHEN at LFNLLC.com, or you can connect with me on LinkedIn, which is again just my full name, Anthony Chen. You should probably see a tag in the back banner of Lighthouse Financial Network. Now, to close off our show, bringing our guests back in. Again, the question is, as you were going through your journey of dentistry, what is the advice that you were most thankful for from your mentor? And would that be the same advice given to our listener, or would you have a different advice of your own?
So I am very thankful for my mentors guiding me to push myself and continue with my continuing education. As a licensed professional, you are required to take continuing education. But best piece of advice I received was to dig deeper. Don't take the minimum. Take the classes that interest you, that push you to treat your patients better, to learn procedures such as implants and Botox and Invisalign. Those are things that you don't learn in dental school. And those are taught in a continuing education setting where, you know, you learn. It's like taking extra classes and sometimes getting a master degree and things like that. But I'm thankful for that advice to never stop learning and pushing yourself, because that's how you can take best care of your patients.
And would that be the same advice carrying forward to our listeners, or do you have?
Absolutely. Always go above and beyond and keep learning. This is the practice of dentistry. It's the practice of your profession, whatever profession you may be in. So always keep learning, keep pushing, and never stop striving for the best to learn and be the best you can be.
Thank you, Dr. Jamie Austin. And again, how can our listeners best find you? Absolutely.
They can find me on Instagram at Dr. Jamie Austin, also on Facebook and Instagram at austindentalroswell.com, and by phone, 770-475-3600. Thank you so much.
Great. Thank you. Now, you all heard it here in terms of advice to carry forward into Thanksgiving and the holidays. And then wrapping quickly on my section here of Anthony's Financial Take in Corner, I would have to steal, maybe pick it back off of our good doctor here in terms of really expanding one's knowledge. It's not just about taking just the minimum to be able to practice whatever profession you're in, but to dig a little deeper. And if you're going to be really a true advocate for yourself, you got to dig deeper than just the surface level to be able to be the expert in all things. Maybe not all things, but know just enough where your comfort level ends and know, okay, I need to bring another professional in. Because if I'm going to be a professional to my client, an advocate to my client, I need to know a little of other things outside of my circle. Because sometimes if it's a blind spot for me in my profession, it's most likely a blind spot for my client. And that about wraps up. And thank you for listening to Family Business Radio.